So in this week from IHME, we have not rerun our models. We've actually been spending time trying to understand the epidemic province by province in China. The key thing there, of course, is the outbreak continues to unfold in Shanghai with very broad-based transmission. Now reports of lockdown confirmed by Baidu mobility data in many other cities within China. So it remains to be seen whether the zero COVID strategy will work to keep COVID or the Omicron variant from spreading very widely in China. What we do know is that vaccine coverage in the 80+ population in many provinces is actually quite low. So if Omicron spreads widely, there is a real risk that what we saw in Hong Kong could reoccur in mainland China. So something that we are watching very closely. Currently, our models are assuming that the success that China's had with the zero COVID strategy, controlling Omicron in February, around the time of the Olympics, could be replicated. But I think we're also hearing reports that the economic costs of this are rising. For the United States, we're seeing rising case numbers in a number of eastern states. There's some suggestion of rising case numbers in other states as well. There has not been a precipitous rise in cases yet. This increase looks to be related to continued relaxation of behavior and, of course, combined with the BA.2 subvariant. The good news there is we're not seeing an increase in death, but it does point out how critical in the US, but pretty much everywhere, access to antivirals is going to be. And while there continues to be a lot of discussion about access to vaccines, both in other countries and low and middle income countries, and even discussion around boosters, there's perhaps not enough focus on making sure that people who need these highly effective antivirals, namely Paxlovid, in the future. This is somewhat important right now for the BA.2 subvariant, but could be extremely important in the future as we imagine that there will be more infectious and potentially more severe variants that emerge during the course of this year. We have started to do some modeling of what would happen if a variant that was as severe as Delta came along with the transmission potential of Omicron. And in that setting, widespread access to an antiviral like Paxlovid really makes a profound difference in saving lives around the world. So very high priority, both in the US, but everywhere in the world, for thinking about health system delivery strategies and access to the drug itself, that those who can benefit from antiviral are going to get that antiviral. So expect more from us in the coming weeks as we continue to track the pandemic and try to model out how future scenarios unfold, both with what we know is currently occurring, but also potentially the emergence of new variants. Last comment is on the people monitoring the emergence of the BA.4 and BA.5 subvariants in South Africa. They are replacing BA.2, and there is some increase in case numbers, but still modest so far, as distinct from what happened with BA.2. But of course, we're now 4 months or more into the peak of Omicron transmission. So some of that increase of BA.4 and BA.5 could be waning immunity from what was established through the early Omicron wave in November and December in South Africa. But clearly another facet of the epidemic that will bear close monitoring.